Hey you guys, welcome to my channel, Mom's Journey. I'm Sharon Michelle. I am exactly 30 days post-op tummy tuck surgery. And I know I haven't recorded anything in a minute because it got kind of boring and it's not really anything to tell you or whatever. But I'm on my way to the Mandalay spa so I can go get my lymphatic massage. And when I come back, I am going to show y'all my scars, how I'm healing, the swelling and all. Like I said, I'm a little different than most people because most people, when they get their tummy tucks and all, and you'll see how swollen, because you can be swollen anywhere from 6, 9, 12 months. They tell you, like, that's the full healing from inside out. I guess the way I compress and I wear my ad boards and stuff like that. I try to eliminate the salts and stuff like that. I don't have that kind of swelling. I can feel swelling because I ate some fish the other night and it had the Old Bay seasoning and all that. I blew up for 2 days, but my blowing up was uncomfortable. Where the incisions and stuff was, I could feel like the tightness. So I continued to keep the garments on, kept my compression socks on or whatever, so I could really tell that. But most of the women been looking like they're pregnant, and they're not satisfied with their stomachs because they don't see their full results yet. But I can say I'm really satisfied with what I've seen so far and how the healing is coming along. Even I realize when I go for my massages and stuff, the girls actually massaging on top of my scar so that, it doesn't keloid too bad underneath and things like that. So like I said, I'm going to get my massage, and when I come back, I'm going to show y'all my scars. I'm going to show you I'm in my stage 2 Faja now. I'm going to show you the 3 different pictures of the first garment I had on. Then I had put a body magic on to see what that would look like, and then I put my stage 2 garment on. Now, I could get a smaller garment, but my legs are super big, and y'all know I get my surgery for my to get the excess skin moved off of my legs in October. So once I do that, I'm really like a completely different size, but you can't tell right now. So I'm gonna get out of here and go do what I need to do, and I'll get back to y'all, okay? These are electrodes. They're put on your stomach and it makes your abdomen contract, or wherever those pads are. It helps to strengthen your muscles, and you feel a tingling sensation, and it feels good. It feels weird, but it feels good. And so that's getting my muscles together. A little uncomfortable, but feel good. All right. So everyone, like I told you earlier, you saw on my clip that I went and got my lymphatic massage. Today is exactly 30 days post-op of my tummy tuck. So it's been 4 weeks for my tummy tuck. So I'm really basically getting back into the regular swing of things. The doctor says 6 to 8 weeks. And then, you can go back to regular working and things like that. Some people would tell you after a couple of weeks, you can go walk on a treadmill, things like that. I particularly wanted to take it cool, take it slow. I can't. We're in a pandemic, the easiest time in the world. So I wanted to do that. So I'm just day by day going by and counting down the days before getting my thigh lift, because I am really waiting for that. I have, as I explained for people that don't know and haven't been on my channel, I had bariatric surgery 17 years ago. I lost 125 pounds. During that time, I basically stayed up and down within 20 pounds. About 3 years ago, my staples or stitches or whatever you want to call it opened up. I was gaining weight. Nobody knew why I was gaining weight. I had gained like 40 pounds in like 4 months. Come to find out, the fluid, food, whatever was seeping through. So I had to go and get a doctor to fix it. And lo and behold, y'all, I've had I guess so many surgeries on my stomach, so I've had gastric bypass. I had 4 hernia surgeries, 2 ventral hernias and 2 umbilical hernias. I've had 2 tubal ligations because people that don't know, I had a tubal ligation, and then once I lost all the weight from the bariatric surgery, mysteriously they told me that my tubes went back together because I had lost so much weight. Wound up having another baby. So through that, I wound up having a baby, and then had another tubal ligation. I've had a lot of surgeries on my stomach, so it had bad scar tissue. So when the doctor supposedly fixed my stomach, he actually closed my stomach up to the point that the acid had nowhere to go and it was seeping out, and I was having problems. And I kept telling them something's not right. And they realized that the acid was seeping. Had it burst, I wouldn't be here talking to you right now. Thank God it didn't, and they did an emergency surgery to fix it. People that have gastric bypasses can tell you that once there's a revision that needs to be done, or you've gained an excessive amount, it is extremely hard to lose the weight again. Normal diets that you go on, you normally gain weight because there's too much of a caloric intake that your stomach is not used to. You still have the gastric bypass stomach, the fixture, the way they've done it. But it just becomes hard. So lo and behold, through the pandemic, I had gained an excessive amount of weight, and then decided that I was going to get start getting the skin removed. And that's when I got the tummy tuck surgery. But in order to do that, I had to lose weight. So I went on a weight loss journey, back on the keto diet, lost enough weight to have the surgery, and here I am. So, as I said, now I'm waiting to get the thigh lift done. All right, so as I said, I am 30 days post-op. Exactly 4 weeks. I had my surgery on March the 10th. And today is April the 10th. So what I want to do, I'm going to show y'all my, my progression. And everybody's different. I hear people talk about, how they're not satisfied with their surgery. They feel like they're just as large after the surgery than they were before the surgery. You swell from anywhere from 6 months to maybe almost up to a year. But because I had so much skin and it wasn't necessarily a lot of fat, my fluid filling up is different because I never get so bloated that I look pregnant or I look overly big. I'm in certain pictures so you can remember where I started from, and you'll see. Now, there are days that you feel larger. There's days that, depending on what you have eaten, because a couple of days ago I ate some fish that was seasoned with Old Bay, and then I made it with the fish fry. And oh God, for 2 days straight, I was stuffed. I had on the scale, I had like 9 pounds of water weight on me. It felt horrible. So I wore my compression socks. I've been drinking lots of fluid to get all the additional fluids off. I've had my lymphatic massages so it can drain out. And today I feel a whole lot better. But that's some of the things that can happen during a tummy tuck, your journey. And there's days you'll wake up and you love your results. And there's days you're going to be like, why did I even bother doing this? It changes back and forth. And what you look like now is nowhere of what you're going to look like a year from now. And then again, with anything, you have to still feed your body properly. You can't eat a bunch of junk, feed your body a bunch of junk. And, you spend this kind of money to have this work done. You want the maximum results you can get out of it. And it doesn't make sense to spend that kind of money and then turn around and mess it up, from the foods and, the things you're doing. So, you got to take all of that into account. So without further ado, I'm going to show you. Let me see if I can get this camera to sit up in a way that you will be able to see me. Let's see. Okay. So as you can see, this is me. And like I said, you don't really look much different. It's still me. But people that don't remember the big belly, you know, when I wear stuff now, it's more, I'm flat in here. So I have my faja on, y'all. You know, I told you I went and got the massage, so. As you can see, now it's just no stomach. I do have boards in, that's what you hear. So I have boards under here. And this is my stage 1 faja, which is too big. It's on the 3rd hook and it's too big. But this is the one I normally wear when I go to get my massages done, because when you're done your massage, it's a headache trying to get all your garments back on, and you know, in enough time. So I just throw this one on. I'm going to do this in a rated PG fashion so that I don't get flashed off of YouTube. And I'm going to have my family members and stuff talking about me. Alright, but I'm going to do this. Here you go. My ad board. Now, y'all, some people will say, oh, the doctor say don't use the ad boards. Don't do this. Don't do that. For me, what I've noticed that keeps the swelling down on that line that comes across when the line for your tummy tuck, I use the boards and I let it sit flat. It keeps the fluid from building up in that area, because even in your little poo-poo area, it's a lift. So that area will fill up with fluid and it'll hurt at times. And so I wear my ad boards. I normally have on my band, my ad board, and my faja. Whatever it is that you do. So when I go to get the lymphatic massages and they're pushing the water to the lymphatic drainage system, I then wrap myself up so that the fluid doesn't fill right back up. So this is my ad board. And it's a little damp because, you know, it's almost like when you're waist training or whatever. And as you can see, and I am swollen, but nowhere what it could be. Now, of course, because my pants is, you know, holding tight on around, it looks like I'm more swollen. But actually, I need to do this in a PG form. All right, hold on 1 second, y'all. All right, so I wanted to do this tastefully. As you can see, and I'm not sucking anything in. Now, this is from this being tight, you know, it's pulling everything out. Now, if I wanted to suck it in, so you can see, this is the me. And I still have a lot of loose skin. I can't get rid of all of it. But as y'all can see, my incision. Now, this is actually, I'm getting ready to re-bandage everything. My incision healed extremely well. I continue to, I take this is all from the oil from her massaging today. But I take the tape off and I just re-bandage it up so that it doesn't, so that I don't have a problem with the incision opening up after the fact. A lot of people will take their bandages off too soon. And my belly button, I'll show y'all. The belly button I hadn't seen in years. It's still healing. They had me put some Minuta honey on it or whatever. And sometimes I try to let it air out because it's still healing. So that white that you see is all of what's going to, that's all like skin on the inside that is going to fall off. And then I have me a little round belly button. But this is my healing process. And this hides right up under your bikini line, if you wear a bikini, even when you're wearing, if you're wearing Victoria's Secret thongs, they have the little bit, it covers everything. So this is, you know, this is what I look like. And as I said, I'm going to insert one more time. So you can see all of this is pushing out because of my pants. Let me show you when I pull this back up. When I pull that back up, this back to the hourglass comes back. So yeah, that's what I'm working with. 30-day post-op, and like I said, it's going to get smaller than this. I continue to wear my garments. I'm getting ready to go into the gym and start walking and everything, and I want to prep my legs anyway to you know, just start working on them before I even have the procedure. And you know, that's it. But it's weird because I can feel my muscles in here, the muscle definition. Like the doctor said, if I was able to right now, I've had what they call erectile diastasis. I'm saying that wrong, but that's when women have children and stuff and their muscles tend to open up. They had to put the muscles back, and being that I didn't have a lot of fat under there, my doctor said when I'm able to start working on my abs, it would be like a matter of 2 weeks and I would literally have abs. Y'all would see the definition of abs. So this is interesting. It's really weird. I keep doing this because this is where you feel like the fluid and stuff. When you're doing them lymphatic massages, you know, you just come and you bring it, you know, you bring everything around and down and push it through the lymphatic drainage system, and you go from the back, same thing. And, you know, so even though it's flat, I can feel where fluid is. And as I said, that can be all the way up to, with some people, up to a year. But as I said, I think I'm doing really well. I have no complaints at all. Would I have done this again? Yes, I would. I had no problems. Dr. Kagan, he's the GOAT. He was at Jolie Plastic Surgery, and now he is at Prestige in Miami. And he is who I'm supposed to let do my thighs in October, but I am going to go see a doctor here in Philadelphia that is used to working with bariatric patients, and they normally get body lifts and skin, you know, skin surgeries for the purpose of that. And if the price is not so bad, then I may just stay in Philadelphia and get it done. So, but I wanted to show y'all that I'm going to have a lot of good things coming up on my channel as I keep you up to date with the tummy tuck. Fortunately, I was a business owner for many years, and I've gotten contacts that were overseas. And when I was younger, people used to call me a designer hoe. If for any ones that don't know what that is, my money went on designer pocketbooks, hands down. Gucci, Louis Vuitton, Ferragamo, Chanel, and Prada, and like anything you can think of, that was me. But I grew up, and when I say I grew up, just for me, understand, I'm not talking about what people do with their money, but for me, I got a family and everything, and my priorities changed. And even though my priorities changed, like instead of me spending $2,000 and $3,000 for a pocketbook, I might go to Poshmarks, or I might go to, you know, one of the secondhand places or a resale, and I would purchase previously loved items or something like that. But one of my suppliers that I used to buy moon bounces and stuff from gave me some connections, and I have a lot of connections, y'all. Our money is different here in the United States as it is in some of the other countries. And so I actually have a hookup with the Louis Vuitton over in Vietnam and the Christian Dior over in the UK. So I'm able to get those things at a fraction of the price because our money is worth so much more. So what I'm going to start doing, I'm going to show you some designer dupes I'm going to show you some some replicas. I'm going to show you some real bags. I'm going to start comparing them. And then I also have what they call mirror image. Now, you hear the statement, you get what you pay for. You get what you pay for, meaning that some people can afford the pocketbooks of their dreams. They can afford whatever they want. But their priorities are different and they don't necessarily want to spend that kind of money on it. For those types of people, I have mirror image bags where you put them side by side, no one would know. You might have a real pair of Gucci glasses on and might have a mirror image bag. No one is going to know anything. And furthermore, nobody should be up in your business like that anyway. But I'm talking about for those people that are used to high end, used to spending money and buying those things and putting this bag and realizing, why am I spending $2,000 and $3,000 for a bag when I done just spent $200 and $300 for a bag and there is no difference. So it depends on what you want. So you can get mirror image quality where you'll spend a fraction of the cost of the authentics, or you can get what they call a replica bag or a designer dupe where it's nice. It looks like it. It might have a couple of flaws here or there, but you're not spending nowhere near the amount of money that you would even do for a mirror image bag, but you just like the look, you like the quality. And the thing is, just because the designer himself didn't actually make the bag, it doesn't change the fact that you're still dealing with butter leather or cowhide leather or a snakeskin or a leopard print or whatever the material of the bag is. It still has top quality supplies that are used on it. Like I said, some of the things you cannot even touch. And I'm talking about, y'all, some like even from your top of the line Bottega, your Bottega bags, your Fendi, your MCM, your Louis Vuitton, your Prada, your Gucci, your Givenchy, your Jimmy Choo. I'm talking about whatever, you name it. I have the ability that if you give me a picture of what it is you want, I best believe I can satisfy what you want. And you know, I'm tired of spending that kind of money on those things. And I'm still going to always have my designer bags. And I'm still going to keep, you know, the things that I like. But I also can incorporate some of these other things in there. And it makes so much sense because when I spend that money on a bag, I could pay my utility bills 3 times over. So it depends on what you want. One thing I am not... I'm not saying, oh, you know, get a replica bag or get an authentic bag. I'm telling you that I have the ability to get these things, and it's up to you what you want to do. I'm just telling you what I like, what I would like to do, things like that. So please, if you're a person that does not like designer bags or whatever, please don't leave no nasty comments. Just keep on going. If you're a person that don't like surgeries, regardless if they're elective, cosmetic, necessary or whatever, but you don't, just go on to the next one. For the ones that want information, because I'm here to constantly give you information on the surgery and the surgical procedures and anything that I've learned during this procedure. Just like someone had asked me a question about the ride home. Do I feel like it was safe to be on an airplane? I stayed in Miami for 10 days. And like I told them, my doctor gave me clearance. And they give you a note and let you know to let the stewards know that every hour you need to be walking. And, I mean, depending on how far you're flying, it was no problem whatsoever. For people that have to do longer flights, they will give you, some people take the shots to thin out the blood so that they don't have to worry about clots and all. But I had no problem whatsoever. Like I said, I'm here to give you information, updates, even things that I find out, like I said, as far as lymphatic massages, and it goes even further than that because in Miami, we got the nice little lymphatic massages, get the fluids out and things like that. As I told you, my daughter had a BBL, so that process was a little different. It was getting the fluid out of the holes, the lipo holes, and things like that. But when you come home, you still need to get these massages, and I've had ultrasonic procedure done on your body, which helps tighten the skin. I've had the infrared ray light, which tightens the skin and helps to rejuvenate that skin back. I've had the pads that actually tingle and squeeze your muscles because it's getting your muscles to working again. I've had the lipo blocks. So the lipo blocks is, it helps with the getting the I guess you could say the fat tissues that are still there. It'll help break down the fat in those interstitial spaces, and it breaks it down into a liquid form. The liquid form goes through your kidneys, then you urinate it out. You drink a lot of water to get the toxins and stuff out, to get that moving. The next time, oh, I also had cavitation today, which is a lipocavitation, and I actually bought a machine. This is the at-home one, and so the girl was explaining to me, you know, you had the ultrasound gel, and you do the cavitation. You're not supposed to do it more than, I think it's 30 minutes in 72 hours or whatever, and it just helps to break down fat cells, bring them to the lymphatic system. And she told me the next time I go, I will be getting, oh, what is it called? Can't think of what it's called at the moment. But anybody that's familiar would know what I'm talking about. They put needles in, and they tell you that they're getting ready to shoot something through. You're going to feel it, and you'll say, ouch. And it'll be a burn, and then it's over. Whatever it is, it goes up under your skin. It starts with a C. Oh, gosh, I can't think of what it's called. But it's a treatment for that. And that I know I'm going to get next time. I'm not really looking up to it because my daughter already told me about it. But, yeah, so anything any information that I get to bring to you, I will. As I said, my channel is a mom's journey. A mom that's been on a journey, still on a journey, going to continue going on a journey. And I'm going to take you with me whenever I go on a journey. So you never know what I might do day by day. I took y'all on a journey with my ombre brows. And as you can see now, I have eyebrows. And these will be to the point where I don't have to do anything for at least the next 1 to 3 years. I wake up like this. So I showed y'all all about that. Soon I am, and for people that don't like tattoos and not into it, please just keep it moving. I was never into tattoos. I got my first tattoo when I turned 50 years old. And as y'all can see, it was my baby on my back, if you can see that. I don't know what it got into me, but I wanted it. But I saw a girl that had a nice tattoo that covered her scar. And I'm going to get that. They say get it when you're still numb. And you stay numb for a very long time. It comes and go. But so as soon as I know that there is no openings whatsoever, I'll probably be doing that. And I'll take y'all on that journey too. So as I always say, my journey is your journey. Let us all journey together. Like, share my page, subscribe to my page. Let everybody know about a mom's journey. And get that notification button on so that you know when I upload another video. Until next time, y'all have a great day.